My name is Kate Jordan. I'm the developer of the Bodywork for the Childbearing Year training and advanced certification program in massage techniques for pregnancy, labor support, and postpartum bodywork. I'm here today to describe and demonstrate an extremely useful technique that is applicable both in pregnancy, in labor, and in the postpartum period. And this technique is connective tissue massage, or Bindiga Vapes massage. Bindiga Vapes massage is a technique that was originated by a German physiotherapist in the 1930s by the name of Elizabeth Dick. It is a technique that relies on the effect of a very precise form of skin stimulation on the skin and superficial fascia to affect primarily the function and regulation of the autonomic nervous system. This technique has both systemic and local effects. Many women in pregnancy have a number of vascular dysfunctions in their legs. These include edema, varicose veins, restless leg syndrome, leg cramping, and oftentimes just a feeling of heaviness or inability to move that especially occurs in the last trimester in pregnancy. I'm going to be demonstrating techniques from Bindiga Vapes massage that address this particular dysfunction in pregnancy, as well as low back and pelvic pain, which are the most common companions of pregnancy. About 60% of pregnant women experience some form of low back pain in pregnancy, usually starting in the second trimester. In order to apply Bindiga Vapes massage, one uses the tips of the fingers, and usually weak fingers, so the index finger is usually not used. One uses the third or fourth fingers, and these applications are done in a very, very specific way. I'm going to be demonstrating on Dana, who is 5 months pregnant and has begun to get some varicose veins in her legs, although she has not begun to get the edema that's very, very common in pregnancy. Pregnant women are most optimally organized for massage and bodywork in the side-lying position. About 90% of my pregnancy massages are done with the client in side-lying. Side-lying increases the return of blood to the heart by as much as 22%, whether your client's lying either on her left or her right side. But side-lying positioning offers some challenges. Most of those challenges are very well met with the Oakworks side-lying positioning system. I'm going to talk about some of the components of this system now, and as I do, I'm going to briefly mention what's important when you have a client in side-lying. Dana's lying on her left side. She has a torso support, which in combination with the head support enables the shoulder to be positioned in such a way that there's no discomfort in side-lying, and she may be in this position for as long as 40 minutes, so it's very important that there's not significant pressure on the shoulder joint. The way that the torso support is designed, the lateral scoliosis, which would occur if you placed a client on the table without any kind of support, is completely alleviated, so that we're going to be able to work and do the effective techniques in the lower back and pelvis with the client very well positioned. She has another specifically designed pillow that's supporting her upper arm so that she doesn't roll over in this position, and then has a leg support that's an extremely firm bolster that will keep her organized in this position for the entire length of the session. So with this kind of positioning, she won't be rolling over. You don't have pillows falling off the table. It's extremely useful, and this is the positioning that I use for about 90% of my pregnancy massage sessions. So back to connective tissue massage. I'm going to be demonstrating first the basic strokes, and in connective tissue massage, all sessions begin with work on the pelvis, and that's because the parasympathetic ganglia exit the pelvis at the foramina of the sacrum. And so if one is planning to work on the upper back or the legs or the arms, one always begins work at the pelvis. And there are basic strokes that I'm going to be describing now. I'm going to draw these strokes with a grease pen on Dana's pelvis and then demonstrate with my hands how these would be applied. And the first stroke is a long dragging stroke along the lateral border of the sacrum. And all of connective tissue massage strokes are done 3 times. So before I move on to the next stroke, I'm going to work bilaterally on both sides of the body with the application of 3 strokes. And the connective tissue stroke is done by placing the pad of just 1 finger on the skin, creating a tensile pull on the skin, crooking or flexing the most distal joint of the finger, and then dragging and pulling through the skin. So the effect on an individual who has dysfunction will be a reddening or histamine response, and there may even be a wheal or a raising of the skin along the lines that have been drawn. And this can last for a couple of hours, particularly in someone who's dysfunctional. And you can see this histamine response now on Dana's body. So the first stroke is a series of dragging and pulling strokes on the lateral borders of the sacrum. The second stroke is a series of short half-inch pulling strokes from the coccyx toward the 5th lumbar vertebrae. Notice that I'm using another finger to brace or splint the finger that I'm using. I'm using my 3rd finger, and my index finger is bracing. And these strokes are about 1/2 inch long. Now, I'm going to ask Dana what this feels like. And what I want her to respond is that this feels like cutting, ripping, tearing, slicing, scratching, burning. None of these words sound very exciting, but none of them have a pain component with them. If she doesn't have that feeling, then she's not getting the effect of this technique. So Dana, did you feel any of those words?
Yes.
Which word did you feel?
Burning, tearing, both of those.
Great.
Yes.
And some people experience this as if you're using a nail or an actual nail or the fingernail of your hand. But this technique is applied with the pads of just 1 finger. So you got your ripping and tearing, so you're getting the appropriate effect. The next stroke is a dragging and pulling stroke that follows the contours of the crest of the ilium. It's followed by another stroke that starts at the tailbone or at the coccyx and travels along the pelvis to meet the first stroke. And this technique is optimally done so that you're dragging and pulling toward yourself. So you, the therapist, are dragging and pulling toward yourself. And you'll notice that we're going to begin to get a histamine response. The third stroke starts at the tailbone, goes even lower on the pelvis, and this is going to be repeated on both sides of the body. And once again, notice that lovely histamine response. This is the response that you're looking to get. And are you continuing to feel those sensations? Good. So that is the third stroke. The fourth stroke is a series of tiny 1-inch pulling and dragging strokes following the crest of the ilium at right angles to the stroke that we just performed. With Bindiga Vabes, as I mentioned, every stroke is done 3 times. It's done bilaterally on both sides of the body. And there must be that sensation of ripping, tearing, cutting, slicing, burning, scratching. Now, why would your client want to experience this? If your pregnant client has back pain, and about 60% of pregnant women do develop back pain at some point in their pregnancy, this particular technique immediately alleviates that back pain. So she would not be feeling a negative response. This would be a very pleasurable experience for her. So that is the fourth stroke. The fifth stroke is a series of 2 tiny little pulling strokes into the V that's made by the crest of the ilium coming down to its joint with the 5th lumbar vertebrae, and then a series of 1-inch pulling and dragging strokes, one for each transverse process of the lumbar spine. pulling and dragging. Into that V, and then one stroke for each of the transverse processes of the lumbar spine. So this stroke moves from transverse process to spinous process. Now Dana, as I do this on the other side of your back, I'm repeating exactly the same protocol. I'd like you to notice if it feels any different to you as I move up your back. Are you feeling any change in the sensation?
Not as much, not as strong.
Right. So as this technique moves above the umbilicus or above the pelvis, the sensation diminishes significantly. So when we got to about here, it's just started to feel good and there wasn't so much of that ripping and burning, correct? Okay. These are called the basic strokes. Once these basic strokes have done, one can move anywhere else in the body with connective tissue massage. On our pregnant clients, we continue with a series of long pulling and dragging strokes up the back, and this will only feel good, Dana. You won't be getting that ripping, tearing, cutting, slicing, burning. Now, this technique is used in therapy settings in Germany. It's primarily used in Germany. And it is noteworthy for its ability to apply it to people that are medically frail. So someone that is very, very ill, a client with osteoporosis, for example, or serious organic disease would be able to tolerate the amount of pressure that's being used in Bindiga Vapes massage. The client does not experience Bindiga Vapes massage as a superficial technique. The client will experience your touch is very, very deep, but the application of this technique is only to the level of the skin and the superficial fascia. So this is the application that one would use for the entire torso, starting with the pelvis in pregnancy. If your client has significant vascular disorders in her legs, which are very common, edema, varicose veins, restless legs, cramping in her legs, we add 2 other strokes. So the first stroke, dragging and pulling in that channel between the greater trochanter and the ischial tuberosity. The second stroke, a series of dragging and pulling strokes from the greater trochanter down to the iliotibial band. Now, this particular application of connective tissue would be useful for any of your clients that have vascular disorders in the legs. I used this most recently on a man with advanced prostate cancer who had begun to get significant swelling in his lower leg, and this reduced it. Once again, we see that histamine response, which is characteristic of connective tissue massage. So these are the applications of connective tissue massage in pregnancy. When we get close to term, when a woman is in labor, we can go back to the first 2 strokes that we demonstrated. And these are the 2 strokes that are used when a woman is ready to have her baby and she hasn't gone into labor. We can apply these strokes during our sessions to help to initiate labor. When she's in labor, they can be used to stimulate contractions to make them more powerful. They also increase relaxation and significantly reduce a woman's perception of pain. These applications of connective tissue massage in labor are only going to be useful for someone who's not using medication. So these are for individuals who are having an unmedicated or a minimally medicated birth. And to repeat those 2 strokes, the first stroke is a dragging and pulling stroke on the lateral border of the sacrum from L5 down to the coccyx. And the second is a dragging and pulling stroke, 1/2 inch to 1 inch long, over the sacrum. Now this is done during contractions, not between contractions, and we're overlying a very important acupuncture point, bladder 32, which is probably one of the reasons that connective tissue massage is so useful in labor. We're going to go on to talk about, in the second part of this video, we're going to go on to talk about applications of connective tissue massage in the postpartum period.